Stand in front of you.
Taking tablets this morning, Alan?
It's not working.
Good morning and welcome to South Australia's daily COVID-19 update. Thank the press for accommodating our earlier than normal scheduled time due to the Estimates Committee hearing today. Joining me today in our briefing is the Honourable Stephen Wade, the Minister for Health and Wellbeing, Professor Nicholas Spurrier, the Chief Public Health Officer, and Commissioner Grant Stevens, who's also the State Coordinator during this major emergency declaration. I'm going to keep my opening remarks today brief because there is quite a lot to get through. I can advise that the CCTV stills related to case 0 of the Parafield cluster has now been forensically examined by both SAPOL and the CDCB. What the review found was that there has been no deliberate breach of protocol and no evidence of people being in the wrong place at the wrong time. This is very pleasing. I'll soon pass over to Professor Nicholas Spurrier, who will walk us through the current status of the CCT review and also provide us with the daily COVID-19 update. But before I do that, I want to make this point. This is a new virus and we're learning more about it every single day. As Professor Nicholas Spurrier said yesterday, there is never zero risk with this virus. But what we must do is put as many shields as possible between the virus and the community here in South Australia, and we're doing just that. Working with the people of South Australia to beat this silent enemy. We will continue to act swiftly and decisively based upon the expert health advice. We do that to keep South Australia safe and strong. On the health advice, we are again further strengthening our already independently gold star rated MediHotel system by taking the following actions. Number one, we will now transfer all positive COVID cases from MediHotels to a dedicated health facility. One option, which we're currently considering, is the old Wakefield Hospital. 2, security at the dedicated facility will be provided exclusively by South Australia Police and South Australia Protective Security Officers. 3, staff working at the dedicated facility will not be deployed to other Medi-hotels or high-risk environments, including aged care facilities, correctional facilities or hospitals. 4, all staff who are working in the dedicated facility have access to the Hotel for Heroes facility so that they have the option to rest away from their home. 5, we will discuss all of these risk mitigation strategies with the AHPPC before implementing them and continue to seek the advice from the AHPPC on secondary employment for Medi-hotel staff and other issues. 6, we will ask National Cabinet to consider testing all returning Australian citizens prior to their flight with a view that they must have negative test results before boarding. 7, the Medi-hotel in question will be thoroughly deep cleaned. And 8, once these new actions are implemented, we will be able to gradually resume our international arrivals for returning Australians. I'll now pass over to Nicola Spurrier and then come back for any questions. Thank you.
Thank you and good morning. So I've got very good news that we don't have any further COVID cases in our state today. So that's excellent news. Just some stats on the Parafield cluster. So there are 29 cases linked to the cluster. And if people weren't up to date with the news yesterday, the 2 international travellers that we've had positive this week, we've added to the Parafield cluster. And the reason for this is that we received middle of the day yesterday the genomic information about those particular cases. What this showed was that they had the same strain of COVID as the Parafield cluster. They were in the Peppers Hotel, so that immediately let us bring the conclusion that those people had indeed contracted that, not from coming overseas, but actually during their stay in the Peppers Hotel. So that's why it's now 29 cases linked to the cluster. We still have 1 person hospitalised. It's a woman in her 50s, but I'm pleased to say that she's stable. My team are continuing to do a huge job in terms of the monitoring and quarantining of close contacts and also contacts of close contacts. And there's 4,300 people in quarantine who are being contacted and also having regular testing. So in terms of our case and testing statistics, there are now 38 active cases in the state with a total of 557. And I was really pleased with the test results yesterday. 9,403, both including our public and private laboratories. So thank you very much for everybody who felt a little unwell yesterday and went out and got tested. And I'm hoping that you had a quick turnaround and you had your SMS back very quickly to give you that negative result. Now, people are very interested, and the press are very interested to know what we have learned by looking at the CCTV footage. And of course, in addition to the CCTV footage, we've had to go through detailed staff lists and roster lists to see who was where at particular times. And so that's a lot of information to get through. So my senior communicable disease doctors, who are expert in infection control, have had an initial look at the still photographs of the CCTV. So that's just the still shots. And they need to do a much more thorough review of the whole video sequence, and that will be happening over the next couple of days. But on the basis of the stills, I can absolutely confirm that nobody was in the wrong place at the wrong time. And I think that is the most important thing. But there are subtle details that they are looking at. They're looking at whether people had touched their mask, for example. When did they touch their mask? When did they touch another surface? So you can imagine it's very, very detailed information that they're needing to have a look at. But what is really clear was that there's no significant breaches identified which would have contributed to the, which we could have said, yes, that's definitely how it was transmitted. So it's much more subtle than that. I also just wanted to make people aware that we now are fairly clear that the Index case, the first staff member that was infected at the hotel is one of the security guards and not the cleaner, and we can tell that by knowing who was on what floor at what time. There was also absolutely no incidences of staff going into people's rooms, into the travellers' rooms, and certainly no inappropriate behaviour at all. All staff have worked in those hotels really doing the absolute utmost and really working to a very high standard, and I think for me that is extremely reassuring. So at this stage, we will have some hypotheses, working hypotheses about how we think both that initial security guard and then the couple who were the travellers in a room became infected. But we may never be able to say 100% because, of course, we're reliant on going back to the history and looking at that footage. But the important thing is we will be able to have more information about how we can make this not only safer for travellers in the quarantine hotel, but also for staff working in those facilities. And I think we are in a very good position because we've had that CCTV at the Peppers. We've been able to follow all of those things through. So I'm very happy to take questions, but I will pass on first to Minister Wade, who's just going to provide a little bit more information on our steps forward to make this both safer for our travellers, but also, of course, safer for our staff and, of course, safer for the whole South Australian community.
I just wanted to touch on a couple of the elements that the Premier referred to. Hotels for Heroes is an initiative that was established earlier in the year. So it's provided particularly for people who are working in COVID environments.
Mr. Sully, can we ask you to...
Oh, sorry.
Thank you.
Thanks very much. Hotels for Heroes is an initiative established earlier this year when we were facing COVID cases in our hotels. It wasn't significantly needed during the first wave, but as we moved to the enhanced arrangements in relation to returning travellers, in relation to the staff, particularly at the dedicated facility, Hotels for Heroes is an opportunity for staff members who might like to rest away from home, particularly if they might have vulnerable members in their homes. As the Premier indicated, we'll also be engaging the National Cabinet, and we expect that they'll take advice from the HPPC in terms of testing incoming travellers. We are seeing an increased rate of prevalence of COVID-19 in international flights, and this is an opportunity to try to reduce the risk before people even arrive at our shores. I now pass over to the Police Commissioner.
I'm just here for questions. I think you've heard everything that I've got to say.
Commissioner, how...
Thanks, Rory.
Yeah, no problem. What stress will this put on police resources to have now officers having to do all the heavy lifting in the Medi Hotel situation?
Well, we're just working through that now, but we've obviously prioritising the resources we have available based on the tasks. One of the things we're looking at is how we maintain posture at the airport receiving passengers when we know that flights are going to increase. There will be a tipping point when we have to modify our processes there, so there'll be some scope to adjust what we're doing, and also our borders out on the roads, we'll be having a look at just how we maintain that as well. As all of the states and territories around Australia open up and relax their restrictions, then we need to reconsider how we manage people who are entering South Australia and the need to do that. So we'll be working through that, and we'll see what that provides in terms of capacity.
Commissioner, do you now agree that staff manning these sensitive quarantine facilities shouldn't have second jobs?
No.
Isn't that what's happening? Isn't that what's happening now?
No, the people, I think it was quite clear that people working in the dedicated facility, which will manage people who are COVID positive, will not be permitted to work in other high risk environments, including correctional facilities, hospitals and aged care facilities. I think that's very different to secondary employment.
Okay, so just to clarify, they could work in a pizza bar, for example?
At this point, yes.
Commissioner, do you see this...
Can I also say, though, that the Premier made it clear that the correspondence has gone to the HPPC to provide independent advice on that. And as with everything, if the advice comes back, then that'll be considered, and we'll abide by whatever advice comes from experts in the field.
Commissioner, do you see this as, despite our assurances for the last month or two that our hotels are completely secure, gold standard, that they're not, that there has been a problem there, that they're not up to scratch?
Well, I think the Premier also said in the last couple of days that we've managed over 8,500 people returning to Australia through our Medi Hotel system. There have been isolated incidents of staff that probably exposed themselves to a level of risk. We don't know what's occurred here at this point in time, and we've always provided the assurance that we've taken every step possible to ensure the safety of South Australia based on how we manage our Medi Hotels, and that's what we'll continue to do. On the basis that we are obligated to support the national program to bring Australian citizens and Australian residents back to Australia.
When will guests be moved to this new location?
That'd be a matter for health. This is obviously the announcement today, and they'll have to develop a program or a plan to implement that. So it's not something, we'll support that, but it's not something for us to respond to.
And when will police be taking over the security services at the hotels?
Probably about the same time it opens up.
And then is that going to coincide with the borders opening up? Can you move some of those
As I
resources?
said, we'll prioritise our resources based on the requirement and the need to ensure safety. So I can't say that one thing will stop to commence another. We'll just look at how we deploy our resources the most effective way.
So can I just clarify, is it only police officers that will be guarding the positive cases at the new facility, not anyone else in any other hotel facility?
Police and protective security officers will be dedicated to the proposed facility, which will be a hospital facility. The current arrangements will remain in place for our COVID hotels.
Right, so that's what I was just going to clarify. So is this still going to stretch you though, Commissioner, this change?
I'm not pretending that we're not under pressure at the moment in terms of our resources. I think over the last few days, over the course of the Parafield cluster and the events that have occurred in the last 10 days or so, our resource allocation to COVID-19 response activities has been over 600 people per day, police and support staff and contract staff that we brought on to assist us with this. So this is a significant diversion from what you might call core policing activities. We are managing those from a priority basis. Some of you may have heard that we closed non-24-hour police stations for a period to free up some resources. So we are looking at all of those critical service delivery issues and managing our resources accordingly. So we'll continue to do that, and it's just a reality with what we're currently facing that, and our role in supporting SA Health, that we are going to have resource commitments to that, and we'll keep doing that.
Do you think your officers, having seen what has transpired over the last couple of weeks, might think, and they'll be ordered to do it, but might think, well, we're just picking up the pieces because a system didn't work. Now we're being subjected to the risk that was at the other hotels?
Look, I've said it before, and I will say it again. I continue to be hugely impressed by the commitment and professionalism by the staff of the South Australia Police who are supporting the COVID-19 response. We have had police officers in every Medi Hotel providing management and oversight of the security arrangements since day one. They come to work every single day and they do an excellent job. They do their very best to ensure that the security framework is as strong as it can be, and I'm sure they'll continue to do that. But we need to make sure that we support our people, both from a general wellbeing point of view, but ensuring that they have the right personal protective equipment, the training to use that, and the respite from these duties when we can provide that.
But Commissioner, that's fine, and officers have been going to hotels that are presumably secure with very few positive cases. Now they're at the epicentre of where the cases are. Why would they be happy about that?
Well, nothing's changed over the last few weeks, Mike. We're still providing a security framework around our Medi Hotels, and I think Professor Spurrier has made it clear that the number of positive cases coming in from overseas has been increasing over the last few weeks. So in some respects, the posture hasn't changed. We're probably providing an opportunity for people who are working with positive cases to have a heightened awareness of their work environment, so we can ensure that maximum safety for them.
How are your resources looking over Christmas? I'm sure like any other workplace, lots of people are applying for leave.
We are trying to manage the leave to allow as many police officers to take leave over this period, and that's always been a part of what we do. There was a period back in the beginning of the COVID response where we cancelled all leave. We have slowly brought that back. We intend to allow as many police staff to take leave over the Christmas period so they can spend time with their families, but we do need to maintain an operational capacity, and our staff are aware of that, and I think they're supporting us at this point.
Commissioner, with regard to the analysis of the CCTV from the Peppers Hotel, have you been made aware of any PPE oversights, be it masks not being worn in the footage, be it gloves not being worn in the footage? Have you been aware of that at any stage during the 400 so hours of TV that's been analysed?
Not specifically, but that's the particular work that SA Health are now doing. They have access to all of the video, and they are going to go through that with a fine-tooth comb, looking for those particular elements that may have been a contributing factor. And as Nicola said, it's this is detailed work that needs time committed to it, so it will take some time to do that. We've done a general overview of the CCTV. We've taken stills of any relevant activities, provided that, and that's the basis upon the advice that's been provided today. But that next level of inquiry will take some time, and as Nicola said, it's necessary for us to do that to satisfy ourselves that where best as possible we can identify how this these staff members may have been infected and then passed it on to other patrons. We don't know the answer to that yet.
Commissioner, how many security guards have been sacked as a result of breaches at the Medi hotels?
I don't know that answer. I am aware that there have been some disciplinary actions taken against, excuse me, some security staff based on non-compliance with PPE protocols and other activities, but I don't have specific numbers.
Thanks, Commissioner.
Okay, just before you do go, a bit of a random one. I know you touched on it yesterday, but it's going to be hot this weekend and the Black Friday sales. Do you have any advice for people heading to the beach and to shopping centres?
We would certainly encourage people who are going to take advantage of the hot weather to just remember the physical distancing rules. We've done a really good job so far together, so let's keep doing that. And if people are planning to go into the Black Friday sales, it is going to be warm, so be prepared for that. And also remember the physical distancing requirements, particularly in congested areas around shopping centre, shop entrances and exits. People should take advantage of the opportunities that come with a sale like that, but we want them to do so safely, not just from a COVID point of view, but just remember, 40 degrees is a really hot day, so don't expose yourself to any unnecessary risk.
And just on Operation Protect, do we have any indication yet on why this person lied?
I'll leave that for a further update by Assistant Commissioner Harvey, which I believe he is aiming to provide before the end of the week, but I won't commit him to that at this stage.
Do you have any comment to make in relation to the statement that he issued through his lawyer talking about unfair and inaccurate information in the public now?
Well, I don't think there's sufficient clarity about what he may be referring to, but we certainly acknowledge the lawyer on his behalf. He's certainly entitled to engage a lawyer. That's part of his rights. The statement that he expresses remorse, I think, is probably obvious based on the conversations we've had with him. But yeah, he's well within his rights to contract the lawyer, and we'll see what comes out of that.
And can I just ask you about guests at the Peppers Hotel in quarantine at the moment? Will they have to restart their quarantine?
That's a question for Professor Spurrier.
Commissioner, just on restrictions ahead of the hot weather, we know that lap swimming at pools is allowed, but classes aren't at this point in time. Why is there the distinction between the two activities in the state's pools?
I'll have a crack at this, but it's probably one for Professor Spurrier to clarify if I get it wrong. Lap swimming is an isolated activity where you are essentially on your own in a defined lane. There's no risk of interaction, or extensive interaction, whereas recreational swimming is about playing and having fun, kids getting together, which means the risk of infection spread is much greater than with lap swimming.
Thank you, Commissioner. Premier, just on that, because you know you have to go to Parliament.
Yes, I'm looking forward to the 7 hours of estimates.
It'll be easy compared to what I'm about to ask you.
Go on.
Please, please, Mike Smithson, Channel 7 News.
Premier, is the fact that 2 people have contracted this virus in a hospital setting, in a secure hospital, is there a duty of care to this state? Do we now open ourselves up to some sort of litigation that we're not protecting them?
No, look, I think, what we know about this disease is that it is new to the world, and Professor Spurrier made this point, I think, very well yesterday. We're learning more and more about this disease every single day. We know it is highly contagious. What we're doing in South Australia is listening to that expert health advice, and we're adjusting what we need to keep the people of South Australia safe.
If there is a claim against the state, we don't have a leg to stand on.
Well, can I just say, we're doing our very best in South Australia to keep the entire state protected, and today what we're announcing is a new 8-point plan to make sure that we've not just got belt and braces, but we've got belt and braces and another set of belt and braces to make sure that we can really do everything we can. We know this is a highly contagious disease. We know that. We're learning more and more about this disease every single day. So are health experts right around the world, and we take all of that information, we put into practice all of those things that are recommended to us to keep our state safe.
And
Given the flights due in for the foreseeable future, there's not a flight from Doha tonight?
No. Look, we have written to the Commonwealth. We've said that we would like to suspend international flights into South Australia. We are still committed to the repatriation of Australian citizens who are stranded overseas. We want to play our part, but we're not going to rush into this. We're going to gradually step back into receiving those people when we receive that advice from health that it's safe to do so.
And has that been extended? Originally that was just until the end of November, but is it now cancelled for the foreseeable future?
Well, what we've done is we've suspended the flights at the moment. What we're now trying to do is to put this 8-point plan in place as quickly as possible. My commitment to the people of South Australia is we're not going to rush back into this, but when we do receive advice that it's safe to start returning Australian citizens via our Medi hotels, well, that's what we're going to do. We were at around 600 per week, which meant that at any point we could have up to 1,200 people in our Medi hotels. I think we're going to probably start back with this at much reduced numbers.
Premier, given the fact that the lawyer's letter yesterday from the pizza worker and making claims that he had been partially dealt with, and I presume he was reflecting on your comments from last week, do you still say he's a liar? I don't think you can
presume that, and I think that, you know, this person's lawyer can make their own explanation with regard to that, and I'm not going to be making any comment.
But in terms of, you stick by your comments that he's a liar.
We know that we receive false and misleading information. This person has expressed remorse. We're grateful for that expression of remorse. We still have an investigation which is underway, and I'm not going to preempt the outcome of that investigation.
But you don't think you overstepped a bit by using that language?
No, we know that we receive false and misleading information from this person. And the point that I'm trying to make to the people of South Australia is it is absolutely critical when you are asked a question by a public health official, they are not looking to gather evidence to then pass on to the police. They are looking to gather evidence to design their response to a cluster. And so it is absolutely crucial that in this situation that people must provide accurate information. This wasn't provided in this instance.
Do you still want to throw the book at him?
I think we need to have this full investigation and find out what opportunities are open to us. Yes, I do think that there needs to be consequences for this type of behaviour.
In future, would you pass on, would contact tracers pass on any information like that to police?
No, I think that you're missing the point. What we're saying is that contact tracers don't pass that information on
You
unless
said
there
it
is.
wasn't, you said it wasn't the intention, but would that it's not the intention for them to get that information, but would that information
Look, I'm
be
happy
passed on to
for
police?
Nicholas Spurrier to do this, because there are some instances when information is gathered that could put other people at risk, and in that instance, action needs to be taken. But for example, if somebody is giving information which has got nothing to do with the spread of the disease, that's not passed on, because what we want to do is to maintain that trust relationship with the person that is providing that information. That's not what happened in this instance. I've seen some commentary that we've gone too hard on this issue, and that we might deter people from giving us accurate information. This is not an instance when somebody gave us accurate information and it was passed on to the police. This is an instance where somebody gave inaccurate information. We took action with regards to that, and in fact some information was left out. It's a very, very dangerous situation, especially when you're dealing with a pandemic.
Just how quickly do you expect your 8-point plan to be rolled out, and why would you announce it today without going to AHPPC first to get their advice?
So the AHPPC, we asked for advice last week, but we can't wait. We want to do everything we can. You would note that we've already taken action ahead of AHPPC advice, which now the AHPPC has taken up, and that's the mandatory 7-day testing in our Medi hotel facility. So there is a perfect precedent for South Australia leading the way with regards to the way that we manage our Medi hotels, and we'll continue to do that.
So back to my question, how quickly do you want this 8-point plan implemented?
Immediately. So we wanted to announce it to the people of South Australia as quickly as possible. We've been working on it for the last couple of days. We think it's a point where we can announce it. Some of the things which are completely within our own control, some things we would still like to refer to the National Cabinet. For example, the issue of testing people prior to them getting onto the flights. That would be an issue which would need to be determined at the National Cabinet level, at a national level, because often flights are, if you like, rerouted, so they would head off going into one airport. They sometimes can be rerouted, so we'd need to do this from a national approach.
Is the term of days, end of the month, weeks? Can you give us at least that sort of
Well,
length of time
we'll
frame?
continue to give a daily update, but let me just say there is no resource which will be spared
So
in the
you don't-
implementation
you
of
don't know
this
how soon
plan.
this can be done?
Immediately is the
Have you got
answer.
a location for this new facility?
One of the locations that we are considering is the old Wakefield Hospital site. So what we're talking about is not a huge number of people. So if you can imagine, we have had up to 1,200 in our Medi hotels. At the moment, I think we have 37 who are infected, but often it's been down as low as 0 for weeks and weeks, if not months. So we're not talking about a massive facility, but at that old Wakefield Hospital, there is a large capacity there which can be flexed up to deal with surges.
On the 8-point plan, a few of these announcements you've made as part of it were actually recommendations from the Victorian Review. Did you actually ever read the review and look at the recommendations? And if so, why didn't we do them earlier? Were they dismissed straight away or seen as
Well, Stacey,
unnecessary?
let's be very clear. Victoria hasn't responded to the Victorian plan so
They've
far.
made changes to
They've talked about making those changes,
They've said they will
and some
be,
of those
just like
things
you're
that
doing
they
today.
are.
They've said they'll be
are
making changes like you said you'll be doing.
Okay, do you want to do the press conference or sorry?
No, I'm just letting you know.
Okay, so as I was saying, we take into account all of the advice which is coming in. I've sort of said this a couple of times today from different jurisdictions around the country and around the world. That informs our health professionals. They provide us with that expert advice. We take action immediately. So they presented us with this plan this morning. We're announcing it immediately.
Premier, how far away is an independent investigation into what's happened here? How far away is that?
Well, let's be really clear. We have subjected ourselves to that national audit. There is an investigation into the false and misleading information that we
No, sorry,
have
my
received.
question is an independent investigation that you have referred to previously. You said that an independent investigation would happen in any emergency in South Australia. When will that start?
Well, that's usually happens after the end of the emergency. So you would have seen with
Well, the pandemic might go for quite a while. So when would the independent investigation start?
Well, that would be a matter for the Emergency Management Council in South Australia. But if I can just tell you about what's happened in the past, for example, with the bushfires in South Australia, we immediately set about putting an independent investigation into place. That was done by Mick Kilty. We were the first to receive that independent report. We were the first to take action on that. And in our budget, we had $103 million that went to the implementation of the recommendations. So with every emergency that occurs, the Emergency Management Council in South Australia determines who should do that so that we can continuously learn from what has occurred during an emergency and look to see if we need to have different resourcing, different posture, different legislation which would support our response in future.
But when
Can
will
you
we see
guarantee
it?
that an independent investigation will examine what's happened here in the Medi hotel system?
I think I've just answered that, but
Will it? Will an independent investigation
well, it looks at all of those aspects. So I can shoot you the terms of reference for the previous one. It's not like we want to try and limit what the investigator looks at. We want to learn from every single emergency situation that we have in South Australia. We want to continuously improve. I think we've demonstrated that as a government since we
So Premier, just
came
to
to
clarify,
power.
that's a yes, an independent
Yes.
investigation, yes,
But-
we'll examine what's happened in the past week or so here.
Yeah, well, what I'm saying is that post this event, we will have the Emergency Management Council decide which person will do that independent review, and they'll look at the entire aspects of the way that we have managed this coronavirus, and if there are any opportunities for improvement in the cold, hard light of day, we will put those into place.
Premier, do you think it's fair that Court of Mentha will be paid nearly $60,000 to compensate them for cancelled flights and accommodation during the pause that wasn't actually necessary?
Well, I absolutely refute the concept that it wasn't necessary.
in
So I don't know where
hindsight-
you've
in
got that
hindsight, it
information.
wasn't necessary.
No,
The
that's,
point I'm trying to make, Premier, is
stop for 1 second there, because it's quite worrying that you don't understand what has happened. There is nobody in my team that is suggesting it wasn't necessary.
Okay, all right. No, hang on, just on that point. So the money that's paid to them when other
Yes.
companies
Yes.
that have had to throw out produce and have lost money, why does Kortamenta get special treatment?
Well, I presume it was part of the contract which was entered into with them, but I don't have details on that. I'm happy to follow that up and come back to
The
you.
authorities have said that the lockdown wouldn't have happened if not for this man's lie, in your words. Doesn't that make it unnecessary?
No, not at all, and I think we've gone through that in quite a lot of detail over the last couple of days.
Perry, just with regards to restrictions, do the events of the last 24 hours cast any doubt over what's going to happen on the 1st of December? Is everything still on track?
Well, at this stage, the Transition Committee is meeting again on Friday. It met yesterday and it will meet again on Friday. We are hopeful that if there is no spike in the number of cases, that we are on track to go back to where we were prior to the Parafield cluster, which would be the density of 1 per 2 square metres, which is, I think, one of the ones which is most interesting to people in the hospitality sector, in the accommodation sector, and also in the arts sector, which are 3 of the sectors which are doing it toughest in South Australia at the
So
moment.
just to clarify, the 8-point plan, you said you want to implement it immediately,
Yes.
but not till the AHPPC.
No, I can read it again, or I can give you a copy of it.
When,
but we
so
will,
when will people be moved into the Wakefield?
we
and
don't
whichever
have that
facility
exact date,
issues?
but we will keep you updated with the daily briefings. But we won't be waiting for the AHPPC to come back to us. These actions occur in parallel.
Premier, if the lockdown was necessary, why did you lift it early?
Because of new information that came in, but it doesn't mean that the 3-day lockdown or stay-at-home order wasn't necessary, and I think we've gone into a lot of detail. We provided the modelling, which came from the Melbourne University, Professor James McCall, which showed that we were unequivocally heading towards a very dangerous situation. So we need to take action, we need to go hard, we need to go early, and we've explained those issues to the people of South Australia. It is not correct to say that this was unnecessary. We determined that it was unnecessary to stay for the entire 6 days, and as soon as we received that information, we provided that update and we moved it to 3 days immediately. And you would have noticed on the Friday morning, 1.5 days in, we actually said, well, we can now lift the restriction with regards to exercise. So we maintain the same position from day one. We act swiftly and decisively on the expert health advice. When that changes, we immediately tell the people of South Australia, and this is a really important process to keep in mind.
When you say the independent review will begin after this situation has ended, does that mean after we don't get any more cases in this particular cluster?
Well, after the major emergency declaration is extinguished.
So that
So
will
once
be
the
into
COVID
next
danger is
year.
over,
Yeah.
Sorry?
Once
COVID's
COVID's
over.
finished with, then we can have an inquiry about what we should do differently.
Well, that's what we've been talking about, yes.
Is that not counterproductive? Shouldn't we be doing it sooner so we can fix
We-
the situation into the
Stacey,
future?
to be really clear, we are taking action. We have just outlined an 8-point plan. So
But the
we-
independent review from it.
there's an independent review which was only concluded about 6 weeks ago,
Before this
which was
situation,
done
before
by
this
Jane
outbreak.
Holton, and we're immediately have written to the AHPPC to see if they've got any further advice on what we should be doing, what other people should be doing, and we have, in parallel with that, announced today our 8-point plan to put belt and braces on with regards to this situation.
Premier, can I just ask just a really quick follow-up?
Premier, before you go, can I
Yes.
just get one in? You've repeatedly said you'd ease restrictions as soon as possible.
Yes.
You didn't want to keep things like closed borders
Yes.
for 1 minute more than necessary.
Correct.
Transition Committee meet on Friday.
Correct.
Could the hospitality industry hold out any hope that the restrictions on them will be eased on Friday?
Well, that would be a decision for the Transition Committee, but it would be against the advice that they've provided to us previously, for the reasons that we've outlined before with regards to that incubation period. Some jurisdictions rely on 28 days. We're looking at 14 days, and that would be the 1st of December.
We saw a breach, a potential breach in procedure earlier in the year when Port Power families were allowed into the state, and there was an independent review launched almost immediately, and we got a result of that a week or two later. Why can't we do something like that now for this, which is much more serious and has affected many more people?
So I think we've gone through today that the police have reviewed, 400 hours of CCTV footage, and there has been no breach with somebody going into the room. There is obviously some ongoing work with the CDCB to look at, well, how could this have occurred if somebody might have touched their face mask or might have touched a surface. This is a highly contagious disease. So that work is being done, and I have absolute faith in the CDCB. We're talking about the top people that we have in this state to understand infection control. So that
Yes,
work
but
is being done.
You're saying an independent review needs to wait until the emergency is being declared over. But
That's
we've
for the
seen
whole. That's for the whole pandemic emergency.
Yeah, exactly. But we've seen an independent review launched very quickly in other cases and finished and completed within weeks.
Well, just to be clear, that was done by a public servant as well. So we wanted to put clarity on that situation. We thought the people of South Australia deserved an explanation as to what had happened with
They don't
regards
deserve
to
one
that
for this?
decision. Well, that we're providing that today.
Thank you very much. Professor Spurrier, just briefly. In your early analysis of the CCTV pictures, have you been made aware of any PPE oversights at the Peppers Hotel, be it masks not being worn appropriately, gloves not being worn by the correct people, etc., etc.?
So the initial advice I've got, and obviously these are just on stills, the staff look as though they've had all the correct PPE on for the areas that they've been in. I think one of the things that's important for us when we were looking at that is to particularly look at which staff member had become infected first, and what we have been able to clarify is that that person was not only on the floor, working on the floor where the person from the UK was situated, but has also worked on the floor at the right sort of timing for where the other couple who have come from Nepal were. So it means that we can link that in terms of time and place, that epidemiological link, which is very reassuring for us. But what we now need to do is, because this virus is so transmissible, and probably, as I said yesterday at my press conference, I'm becoming to realise it's even more transmissible and more contagious than I probably even imagined, that we need to go and look at the really detailed information about, look at the views, because we haven't had the videos yet, and that's going to be important to look at that in real time about when somebody might have touched their mask, for example, and when they might have touched another surface. We're even going to the extent of looking at when the vacuuming was done on the floor and when bags of food have been placed outside people's rooms. So it's not, it's actually really detailed information. It's going to take us a bit of time. The reason that we need to do it very carefully, and I know that South Australians want to have, an answer, but from my perspective, I want to make sure that we have as much information about how this virus transmits itself, because that has implications for the safety not just of Medi hotels, but of course in terms of the advice that we give the general public as well. And one of the things when we're talking about wearing masks is we do say, don't put your hands up to your face, and use the hand sanitizer and wash your hands regularly, because we do know that it can be transmitted from surface to surface as well as droplet transmission.
Can you tell us whether all of the people, the staff and the guests at Peppers who were retested late yesterday afternoon, have all those tests been processed, and
Yes.
have they all come back
Yeah.
negative? So there's no outstanding cases?
So I had can't say I actually looked at the email, but came through at 4:20 in the morning. So SA Pathology stayed up and did 75 tests of 75 staff. And as I understand it, that's at least a third, if not more, of the staff in that environment. So what we want to know is very, very quickly, and that's why we got in and did the extra testing, that there is absolutely no chance of anybody else being positive there at the moment. And one of the questions that you asked was, will this, could it mean that these poor people at Peppers who have already done 14 days and now got another 14 days of quarantine, does that mean they have to have another? Now, we're very clear, if everything is negative, then of course, no, they won't. So that's one of the reasons why we did it.
So can you guarantee today that none of the guests in quarantine at Peppers will have to restart their quarantine?
That's absolutely right. I'd like to see all the tests back, but all of those that were done yesterday, and of course that's one of our key things that we're doing in this 12 hours is to have all of those tests
So
back.
are all the tests back?
So all the ones that were taken last night, and as I said, we had 75 staff tested yesterday, and my understanding is that's at least a third, if not a half of all the staff that work at the Peppers.
Okay, so just to clarify, you can't guarantee yet that the guests there won't have to restart their...
I would be very sure that they are not having to restart. So let's just get that correct. But my information this morning was that all the tests that were done and taken yesterday afternoon are negative, And there are still, I've been told, there are still some staff that need to have testing, because of course we didn't have much time to do all of that and chase everybody up, but they should be back today. They're the sorts of tests that we prioritise.
And what if they come back positive? What if they come back positive?
Let's just get the results first rather than hypothesising.
Well, I think the guests at the Medi Hotel, they really want to know if they have to
Obviously,
restart their
and of
14-day quarantine.
and of course, they will be the first to know.
Is it just staff that are being tested, or is everyone, all the guests in the hotel
No,
being
what
retested?
we needed to do was test absolutely everybody in
Some
that
of them
facility.
say they haven't been tested yet. Is that your understanding? Will that come soon?
Look, all I can say is we need to have everybody tested.
And some of them are saying that they haven't received a call from SA Health at all within the last 48 hours, and their mental health is really waning. Why hasn't anyone contacted them?
Look, I'll follow that up after the press conference, but it's a very important thing to raise. Thank you.
They're sending us questions to ask of you, so they haven't been able
Please,
to talk to anyone.
please forward that to us. We're very happy to look at that.
Professor,
Thank you.
just with regard to the dedicated medical facility, is the former Wakefield site the only site you are considering?
It's probably better for the Minister to speak on behalf of the other health sites. We certainly, early on in the pandemic, looked at the Wakefield site, because if people remember, when this first happened, we thought we were going to have loads of people needing ICU. And please just take a thought for the people in the UK, across Europe and America, where there are thousands of people with this disease and many people in hospitals. So we do have that facility available, but we need to go in and make sure that it's fit for purpose, obviously.
Professor, if people have been tested, like the 9,000 or so yesterday, and there's hay fever around at the moment, if they've received a negative test and still have symptoms, should they be retested?
If they've got the same symptoms, then no. If the symptoms get worse, then yes.
When will the infected cases be moved to this new facility? When will that process start happening?
Well, we obviously need to make sure that there's beds and that there's staff and that there's, we've got the kitchens sorted and there's food and such like. So those things take some time, but as you can hear from the Premier and the Minister, we're very committed to making these steps
Are we
happen.
talking days, weeks?
I can't give you the exact number of days or weeks. All I can say is that this is a really important thing that we're doing here in South Australia, and we will get it done as soon as we possibly can.
What do you have to say to those guests in the hotels that say, they were put in there because they were told that the public needed to be kept safe from them, but now they're getting it from the public, from the South Australian public, and they're really worried about their safety at the moment?
Well, obviously, that would be really concerning, and we want to make sure that we get messages to those people. And I guess the other thing is, of course, I do feel for the staff there as well, because they have been working in a high-risk situation, and that perhaps was not fully appreciated by South Australians, but as the number of cases across the world increased, the risk increases. And I've always said that whilst we haven't had COVID-19 in our state, and many of us have perhaps got a bit complacent and we just want to get back to normal, you have to look at what's happening in the rest of the world and appreciate that the risk cannot be eliminated. And the last thing I'd like to say is I'm really looking forward to a vaccine, and I think South Australians will be agreeing with me on that point.
Can I just ask on the CCTV, how come you only looked at still shots, not the actual moving footage of the CCTV? Why just stills?
So it was really what we were given. So our staff were given still footage first, and that was because we wanted to be able to locate which case we thought, which worker we thought was going to be was the index case, and we needed to quickly link it to see whether it was a epidemiological link in terms of time and place. We have now been given the video footage, and then my staff will look at that. But you must be patient. It's going to take them a bit of time, and this is the sort of thing I don't think people should be put under pressure to do, because they have to be very thorough with it, and that's what you would expect, to give doctors time to do that sort of work.
Thank you, ladies and gentlemen. Thank you.